So today we're at La Croissante Figaro here in Outremont in Montreal. We're talking to various people who are involved in mental health projects.
My name is Santoro. I'm 43 years old. I'm married. I have a daughter who's 8 years old. I have a home. I have a job. I work more than full time, and I live what I consider a normal life. Even though I have a mental illness.
Can you tell me a bit about your mental illness?
Sure. Well, when I was 13 years old, my father passed away, and a year later, when I was 14, that's when the illness first started.
You said you had schizoaffective disorder. Can you tell us a bit about what it is and the symptoms and the impact on your life?
Well, schizoaffective disorder, if I could explain it in lay terms, is basically you have bipolar, where you have the highs and the lows, and you have schizophrenia, which you can lose touch with reality. So I have the benefit of having both. I'm somewhere in between. So when I'm not well, I could have the highs and the lows, and I could also lose touch with reality.
What can you give us an example, or what does this mean?
Well, losing touch with reality means not being, having ideas or not being connected with what's really going on at the moment. So if I could give some examples of things that I've done in the past when I was psychotic, driving around all night, pretending as if, thinking that I was a security guard, and I had to, keep people safe in people working late at night in, for example, convenience stores. So I'd go from convenience store to convenience store, making sure that all the workers were safe.
Since you've had the illness, can you tell me what happened? You made a good recovery. What factors do you attribute that to?
Well, the first 8 years, from the age of 14 to about the age of 22 years old, I had many hospitalizations, probably about 12 or 14. I like to use the number 12 or 14, but I really don't know how many. I remember being, at one point I was in hospital, tied to a bed in isolation, and everyone around me was saying that I had a mental illness. And I wasn't accepting the fact that I had a mental illness, and I kind of came to the realization that, if it's true what I'm saying, that I don't have a mental illness, then why am I in this hospital? Why am I keep on coming into this hospital? Why am I tied to a bed? So I kind of sort of started thinking, maybe they're right. Maybe the people around me are right. Maybe I do have a severe chronic mental illness. And it was only at that point that I really started accepting the fact that I had an illness and accepting the help that was available around me.
What kind of help did you get?
At first, I just had my sister, really, that was there for me. But we got community organizations involved. We looked for the right doctor. We kind of built a support network around me, and that took many years to build, actually. So at one point, it was at a certain point we had about maybe 10 different organizations or professionals working with me. And then as time went on, I needed less and less of those that help. So since 1995, I have not been hospitalized. But you have ups and downs. As every year there's ups and downs. There's change of medications, but I know myself really well. So even though there's ups and downs, because I know myself really well and I have a good support network around me, I'm able to keep things under control.
And what mental health services do you receive now?
Well, right now, really, I still deal with a community organization. It's a community worker that I deal with. I've been dealing with him for over 25 years. The same worker, which is we have almost like a marriage, and so that's still one service that I receive. I have my psychiatrist that I still see. I don't see very often, but I see it's as needed. And also, I have a good network of friends and friends, people that I know, family, people that are around me that support me.
Do you still take medication?
I tried many times to get off of medication, and I realized that for me, medication is important. It's important, but it's what I call the 80-20. For me, medication is 20%. It's an important 20%, but it remains 20% of all the things that I do.
On that subject, 80-20, I believe you have a website, some projects that you've conducted telling people about your life, your recovery. Can you tell us a bit about this?
Yes, I've been actually doing presentations for the past 16 years, and I've done over 100 presentations about my story and talking about the tools and that I use to stay well, other than medication. And my dream is to go across Canada and hopefully one day also across the States and bring that message out and bring the message of hope that people with mental illness, that it is possible to live well despite the fact you have a mental illness. You know, recovery is basically mental health. And for me, mental health is not only for people with mental illness, but it's also for the general public. With a mental illness, if I don't have my mental health, I can't enjoy my daughter, I can't enjoy my wife, I can't enjoy the simple things in life. You know, like walking down the street and just enjoying the greenery, or enjoying the people that are out there, having conversations with neighbors, and often it's you know, we kind of think that we need this big thing in life to be happy, but often it's the little things in life that make us happy. And so when you have your mental health, you have a lot more. So you don't need necessarily money to be happy. You need your mental health.